I want to welcome our presenters today from the Sioux Falls VA Medical Center. We have Jackie, Allison, Megan, and Amy, and I'll let them talk a little bit about each program that they're from. But Jackie, if you could go to the next slide. They are going to talk about care coordination, which is a big thing with the VA. And oh, uh, so sorry, I thought there was a different slide in there. Just a disclaimer for everybody that we are going to thank you. Yeah, recording this presentation and putting it up for public viewing for folks who can't make it. So just keeping that in mind. And with that, I will turn it over to our presenters. Thank you, ladies.
Thanks, Erica. Sorry, I added in a quick agenda slide at the last minute, just so that you all have an idea of what we're going to talk about today. So I am just going to head back to that slide for a moment. But first of all, welcome and thank you for coming and joining us today as we talk about care coordination for our caregivers this afternoon. We're so glad that you can be here with us today. Just wanted to throw together a quick agenda. And we're really going to talk about what is care coordination and what does that look like in terms of emergency care, community hospitalizations, accessing home health services. How can we help our veterans with referrals to higher levels of care if we are noticing that that is a need? How can we help them coordinate outpatient appointments? We're going to briefly touch on advanced directives and then just go through some scenarios. So as Erica said, if you do have some questions, we are happy to answer those questions as well as we move forward. So just want to do a quick welcome. Again, my name is Jackie Jaden. I am a social worker here at the Sioux Falls VA. My primary role here at the VA is the social work program coordinator for the care coordination and integrated case management team. I also coordinate a fairly new program called Veteran Directed Care.
I'm Allison Grong, social worker with Community Transitions. I apologize. I'm having some technical issues and my camera is not working, so bear with me.
My name is Megan Van Sloten, and like Allison, I am also a community transition social worker. We're both in our care in the community department here at the VA, so we help all the community hospitals in the greater Sioux Falls area, all the way up to Aberdeen, down to Sioux City, out to Worthington, assist those case managers and discharge planners with veterans that are in those hospitals.
Hi, everyone. I apologize. My camera is not operating, but my name is Amy Schultz, and I'm a registered nurse here at the VA. I've been here for almost 19 years, and I'm partnered with Jackie Jaden in our care coordination and integrated case management here at the Sioux Falls VA healthcare system. Thank you for inviting us. Okay, so what is care coordination? Care coordination is a collaborative approach to healthcare that involves organizing a patient's care activities. So that can be anything from appointments to consults to making sure they get their medications, any equipment they need. So that's all of the patient's care activities. It also involves sharing information among all the team members that are caring for the veteran with the goal of achieving safer and more effective care. So there's various healthcare services across different levels and settings. So hospital, clinics, and home care. And sometimes when we're transitioning from one to the other, that's when we need to pay closer attention to that care coordination and make sure that any changes or new things are ordered, delivered, that kind of thing. Next slide. So what does care coordination look like? It looks like bringing a list of current medications to appointments, and if you're hospitalized. This is very helpful to those that are taking care of you that might not have records, especially, but also sometimes there are changes that are made, maybe in or outside the VA, and you're then going to your next appointment, or you're in the hospital that may be in or outside the VA. So you always want to make sure to update your VA primary care physician regarding any changes. Post the last appointment, or if there was a hospitalization. That can be done through My Healthy Vet or dropping off a list at that respective clinic. You also want to communicate with PACT regarding any appointments that are in the community and recommended follow-up care to ensure that primary care physicians are up to date with your medical care and your needs. Primary care providers will also need to place appropriate consults for prior authorization. So if you need equipment ordered, or if you need an appointment outside of the VA or even inside of the VA, they place those appropriate consults. Bring your community care authorizations to your appointments. They have good information for those providers. You should be receiving letters with that authorization number once that appointment is scheduled. Those are very valuable, and you'll want to refer back to those and share them with those that are at your appointment. Next slide, please. Coordinating appointments. It is very helpful to maintain a calendar with upcoming appointment dates, times, and locations, and some even like to have the names of those providers there in that calendar. It comes in handy when you're canceling appointments due to hospitalization, that way you know what's coming up. It can also be very helpful when you're arranging transportation to appointments. And then again, always bringing a current list of medications to each appointment, and having someone attend appointments with your loved one is very important. Two heads are better than one when it comes to remembering things that you need to remember afterwards, but also it's helpful so that you can ask questions while you're there and get your questions answered. Next slide, please.
Okay, we're going to talk about emergency care. So say you're home with your loved one and they experience a medical emergency, and you need to call 911 and have them brought into an emergency room to be evaluated. So if they're going to go via ambulance, it's important that you notify the EMTs that they are a veteran. That way they know that they can call the VA and they can see if what your loved one is needing care for can be worked up here at the VA. If it's not, then they will give you the option of being sent to a different hospital in town, whether that's Sanford or Avera. They would divert you over there for the care. By letting that EMT know that your loved one is a VA patient, they'll be able to bill that ambulance ride, but also it kind of helps with the process of getting authorization for the emergency room visit, or subsequent hospitalization if needed. Next slide, please. Okay, so what community hospitalization coordination looks like? This would be, say, your loved one does get admitted to Sanford in town, Avera. Say if you're outside of town and you get admitted to Avera in Aberdeen or Sanford in Aberdeen, anything like that, you're going to want to let that hospital know as soon as possible that your loved one is a veteran. We have at the VA what is called the emergency notification line. This line needs to be notified of a veteran within 72 hours of arrival at an emergency room. They ask when you call that number, questions on how they arrived, whether you drove them, they drove themselves, whether they took an ambulance, the date they arrived, what hospital they went to, and then what was their presenting problem, say chest pain, stuff like that. This is something that you can do as their caregiver or loved one. This is something the veteran can do if they're able. It's also can be a very stressful situation going to an emergency room. So you can also ask that, somebody at that hospital calls as well. Typically, they'll ask their billing or utilization management team to make sure they have the right insurance on file for that. You are always welcome to use your private insurance as well, Medicare, Medicaid, if you have any replacement plans for those, but you have to choose one or the other. It's either got to be that private insurance or you're going to request that the VA reviews for authorization for the emergency room visit or hospitalization. You cannot use both. Next slide, please. And in talking about, that 72-hour line, it's never guaranteed that the emergency room visit or the hospitalization will be covered. It's very important that it is called in within 72 hours of arriving at the emergency room. That's a very big factor. You could call 73 hours later and they might deny it just because you didn't get it in within that 72 hours. There's other things that they may deny for. Sometimes veterans will go directly to a community hospital and drive right by the VA on their way. And then they see that and they could think that you should have stopped at the VA emergency room before going to a community hospital, which is a big part in letting your EMT know if they go by ambulance that they are a veteran and you want to see if they can be taken care of at the VA before going to a community hospital. That's the whole part of the care could have been provided at the VA. It's also to note too, if you live outside of town and your town has a hospital or an emergency room, that you always go to the nearest emergency room. We don't want you to have to drive an hour to Sioux Falls to the VA when maybe your town has that emergency room. You always want to get that care as close to home as possible. And then they can, if that emergency room needs to send you to a bigger hospital, they can do that. Next slide, please. And then say your loved one does get hospitalized after that emergency room visit. All hospitals either have a case manager, sometimes they're nurses, sometimes they're social workers, some type of discharge planner that will be assisting your loved one and you with the discharge plan as the workup goes with the provider. They will be the ones that you'll want to contact at the hospital that your loved one is at. They can help answer any questions, clarify maybe what the provider is doing, and talk about what the discharge is going to look like, whether that's needing to, maybe go to a nursing home for rehab, maybe come to CLC at the VA for rehab, and maybe it's as simple as just needing some home health care. But they have contact information to individuals here at the VA that they can talk with regarding, what your loved one may be eligible for in regards to the home health care, what the VA can and cannot authorize, getting medication sent over here, any equipment needs, stuff like that. So it's very important that wherever your loved one is, that you're talking with those case managers at that hospital to help coordinate that care.
Next slide. Oh, thank you. Okay, so advocacy. If your loved one has a diagnosis such as dementia or severe mental illness, talk with the care team about coping skills that may help during their hospitalization. Don't be afraid to advocate for your loved one during these times. You know them best and can help be their voice to ensure safe and effective care. Any medical care that is being received at a community hospital should be communicated with you. If you have questions or concerns about the care that your loved one is receiving, speak with the care team at that facility. Next slide, please. Okay, so if your loved one is at the hospital and being discharged to home, a few things to note. Request that the community hospital fax any discharge paperwork, including medication changes and follow-up appointments to your VA primary care provider. If you don't hear from your primary care provider team within a few days, I would reach out to them to ensure that they've received any discharge information. Any follow-up appointments that resulted from that hospitalization need to be authorized prior to the appointment. So the provider would have to enter in a consult, and then it would have to go through, if it's a care in the community appointment, it'd have to go through that process and before being authorized. So just be paying close attention to any sort of follow-up appointments and communicating closely with the primary care team. And then again, just communicating any medication changes. Next slide.
Okay, I believe this is where I take over. So home health considerations. If your loved one is determined to need in-home care services during their hospitalization, for example, skilled nursing, physical therapy or occupational therapy, personal care services, which is like home health type of services, respite care, things like that. The hospital that your veteran is at will have case managers in that hospital who can notify the appropriate VA team to request a consult be placed. Oftentimes, as you may know, when someone is hospitalized, they will have physical therapy and sometimes occupational therapy come in and do assessments with them to just really assess what level of care is needed at the time of discharge from that facility. And so they will put their recommendations, talk with the provider about recommendations so that the appropriate folks can be notified. However, if you're at home and your veteran has not been hospitalized, but you are noticing they have an increase in physical needs, or they're just becoming weaker, or maybe you are feeling overwhelmed. We know as caregivers that is a really big responsibility to be the caretaker for someone, and sometimes that can just be really overwhelming, especially when their needs become more and more as they age, or with certain medical conditions or what have you. Sometimes things just become overwhelming. So let's just say that your veteran has experienced several medication changes, and even you are unsure of what all of those medication changes mean or what is needed. Reach out to the primary care provider, and they can put in a request to determine if your veteran would be eligible for some skilled nursing, to have a nurse come in and help with that medication management and setup. And they would do a nice job of explaining the medications and when to take them, and really help you and your veteran have a nice setup so that you know when to take which medication and things like that. Or maybe you're feeling overwhelmed and you're like, my goodness, I just need a break from time to time. I have my own errands that I need to run, and I have some other responsibilities that I need to take care of. Again, reach out to your primary care provider, your veteran's primary care provider, and talk to them about some possible respite hours. They can again put that consult in, and we can explore whether or not your veteran may be eligible for some in-home respite to give you that opportunity to step away and attend to some other responsibilities that you have. Just something to kind of be mindful of as when requesting those home health services. You will receive a phone call from a member of our home and community-based services VISN team. It's usually a nurse or an occupational therapist or a nurse practitioner. Some member of that VISN healthcare team will reach out and complete a comprehensive needs assessment to really determine the areas of strength and areas of need with your veteran. Just a caveat to that sometimes it can feel a bit invasive because they do ask some rather personal questions about their ability to take care of themselves, but it really is just to gain a better understanding of what services would be most helpful for you and your veteran. And then once that assessment is complete, a nurse from our local VA facility will reach out to discuss eligibility and service options and program options so that we can get you and your veteran the right services in place moving forward.
Okay. If your loved one discharges to an assisted living or long-term care facility, ensure the following. Notify the facility of all upcoming care and VA appointments, and ensure the facility has a complete list of medications and any medication changes. If this would be a new placement on discharge, going to the assisted living or long-term care, communicate any helpful coping strategies and or bring a comfort item. Work with the facility closely. They'll have guidelines of what can be brought in, what can't, but making it a home-like environment for them is going to help them adjust a little bit easier. And then notifying VA primary care team to provide an updated address and ensure medications go to the right location. Again, if it's a new location for them, we want to make sure that that transition goes smoothly. So updating that address will help medications, supplies, anything that we're sending out go to the right address. And then next slide. If your loved one moves into a contract nursing home for long-term care, they will no longer be eligible to see a primary care provider at the VA, as this is covered under the contract nursing home benefit and will be provided through the facility.
All righty. Sometimes folks, again, will transition from their home to a higher level of care. So you may recognize even prior to a hospitalization that the cares that your veteran is experiencing is just getting to be more than what can be provided at home. You may reach out to your caregiver support social worker, or your caregiver support team, or your primary care team, the PAC social worker, we call them, for a list of long-term care facilities or assisted living facilities in your area. We recommend that you reach out to those facilities and schedule a tour so that you go tour a couple of them. If you have the time and the opportunity, tour a couple of different facilities to get a good understanding of what each facility provides. And make sure that you bring a list of questions. We encourage folks to write questions down prior to that visit and bring questions with them, because we know in the moment we're not always thinking. It could be very overwhelming and you get a lot of information, so you're not always thinking clearly. So having that list prior to going is always helpful. And then also discussing cost and financials. Each facility, assisted living or nursing home, has different costs associated with their care. And at assisted livings, there's different add-ons that can be provided each month that will add some financial liability there. So make sure that you are getting a good idea and understanding of costs associated with each facility so that it can be fiscally manageable for you as well. And then once you've selected the best facility for your loved one, contact your veteran's primary care team and request records be faxed over to that facility. And then once they are accepted into the facility and move into that facility, making sure that the staff have an updated list of any upcoming appointments, both in the community and at the VA, just as so that they're aware and transportation can be arranged if necessary. In terms of community outpatient appointments, if you are requesting the VA pay for any follow-up or any outpatient appointments in the community, you want to make sure that these have been communicated to your veterans VA primary care team. And again, that those necessary authorizations have been in place. If an authorization lapses or if an authorization has not been requested for a certain appointment or procedure, we cannot guarantee that it is covered. So it never hurts to double check and make sure that the appointment has been authorized. Again, a new authorization is needed with every procedure or new recommended visit. And then again, just attending those appointments with your loved one to ensure that you stay aware of what is happening with their care and any recommendations. We know when we're patients, things can kind of be overwhelming and we don't always hear everything that the doctor is telling us. And so having that second person with that second set of ears and someone who can ask those questions is always super helpful. So if you're not able to attend, we encourage to have a friend or another family member attend with the veteran, just so that everybody is getting the information that they need. And then, excuse me, following up with your veterans VA primary care team as necessary post-appointment is also recommended. VA can only authorize a primary care provider at the VA or a community care primary care provider. So this is just in terms of primary care physicians. We cannot authorize and pay for both a VA primary care provider and a community care primary care provider. So at the same time, just because both physicians will have different ideas of best plans of care for the veteran. They may prescribe different medications that counteract one another, and they don't always communicate their recommendations with one another. So it's best to either have a VA primary care doctor or a primary care doctor in the community, just for continuity of care purposes. And also when it comes to insurance, they may see this as double dipping into different funds, especially if you are using Medicaid or Medicare funding for those community primary care appointments. And then care coordination within the VA. We always, when able, we know that demographics play a role in your ability to see a VA primary care doctor or receive all services within the VA. But anytime you have the ability to, we encourage the majority of care be done at the VA, just because it helps us as social workers and nurses. It helps us with continuity of care, and we are better able to communicate and help you understand needs and recommendations moving forward, and help you as the caregiver with those care coordination services as well. And so if you are receiving care within the community, it's really important that you maintain communication with your caregiver support team and the primary care team. And then again, as always, advocating for your loved one and what is best for them. Anytime you come in for an appointment, you and your veteran are know the veteran the best, and you are the experts in them. And so it's important that they have someone who can help be their voice during these appointments.
Okay, we're going to briefly touch on advance directives or healthcare power of attorney documents. If the veteran has completed a advance directive outside of the VA, make sure a copy is provided to caregiver support social worker, a PAC social worker, or primary care social worker, so it can be uploaded to the veteran's health record here. If the veteran were to complete an advance directive out at a community hospital while they're hospitalized, that community hospital will ensure that you get copies of it. Bring it into us afterwards. Bring it into any hospitals or clinics that you may have follow-up appointments at. This just ensures that the veteran's wishes are communicated and known from the start of their care. Okay, we're going to go into a few different scenarios. If anyone feels comfortable taking themselves off mute and answering it, please do. If not, that's okay. Okay, so our first scenario, you and your loved one are enjoying a quiet evening at home when you noticed your loved one experiencing a sudden medical event that requires medical attention. You call 911 for an ambulance and are brought to a local community hospital. How can you, as their caregiver, ensure they are receiving VA authorized care? Okay, so first step would be notifying an ENT that they are a veteran. If they're local here in Sioux Falls, they will call the VA and see if able to present to the Sioux Falls VA ED. If we are unable to accept due to needing specialty care or services that we just can't provide here, a higher level of care, they'll place that ambulance diversion note. And then secondly, call the emergency care notification as soon as possible within 72 hours of them arriving at that ED.
All right, our second scenario is your loved one was hospitalized after a fall and sustained a broken hip. They are being recommended to follow up with an orthopedic provider in the community. How do you ensure that this follow-up appointment is authorized by the VA?
Discuss with the discharge planner or the case manager that the
Yep.
loved one is a veteran.
Yes. Yep, that's a great start. When you say veteran, those case managers at the hospitals are very good about calling over to the VA. They'll call right away. They want to get the primary care doctor's information and fax number so that they can send when he's ready to discharge, they can send that referral over here so that that provider can place the consult for that follow-up with the orthopedic provider. So that's a great answer there. Sometimes I will say community hospitals, they're very quick to just calling their own, orthopedic provider, which, is totally fine. But you just want to make sure you say, hey, my loved one is a veteran and I would like this, follow-up care authorized by the VA. Can you please call the VA and send that over to my provider so they can put that consult in, and they will gladly do that for you. And then that will ensure that care will get covered.
All right, and then scenario number 3, you have been the caregiver for your loved one for several years. Excuse me, you begin to recognize their needs are getting to be more than what you can safely provide at home. What should you do?
Contact his primary caregiver through the VA and discuss that with them.
Yeah, absolutely. Yep, you can contact your your primary care team social worker or your caregiver support team and request a list of facilities in your area. They will be happy to provide you a list of assisted living or nursing homes in your area, depending upon what needs are and what you feel would be the best level of care for your veteran. And then you'll want to reach out and schedule those tours with those facilities and bring that list of questions with you, talk about financials, and then talk with your veteran or your veteran and the rest of your family, or whoever may be involved in those conversations, and decide on a placement. Call your primary care doctor, your veteran's primary care doctor, and they can fax records over to that facility. So yeah, absolutely.
And next is scenario number 4. Your loved one was recently hospitalized and several changes to their medications occurred during their hospitalization. You're feeling overwhelmed with all of these changes and feel additional supports would be helpful. Who can you contact to request additional services and supports in your home?
Again, the same primary care physician and the support team that the caregiver that we're visiting with right now, asking them to, I guess, direct phone numbers, that sort of thing that I would be looking for.
Yes, very good, Mary. There's different ways that we can evaluate the veteran to determine what exactly the needs are and then get you connected with the right home resources and supports. So, yep, first step would be getting in contact with that primary care team, caregiver support, and then they can make those requests for you after they determine the need. Next is tele-ED. Not everyone is aware that we have an RN triage and a tele-ED number that you can call if you're unsure if your loved one actually needs an emergency department visit for hands-on medical attention, or if their needs can be managed at home. So these are the phone numbers that you can call and discuss that with nurse triage, and then that would either lead to recommendation to visit the local ED, or they do have ED providers that can interact with you over that phone number and get you the care that you need that way too. Some additional resources and handouts that are available are ambulance need to know, co-payment information, understanding the community care process, and VA Health Connect. There's a brochure for that. Again, we just want to thank you for having us and for being interactive, and we appreciate our time with you today.